Good afternoon. My name is Stacy Madrano. I'm a nurse here at the Lifestyle Medicine Center, and I'm going to talk to you today about heart failure. Some topics that we're going to discuss is what is heart failure, how it affects you, ways that we can manage the condition at home through lifestyle changes, and when to call our doctor. Heart failure is when the heart does not pump blood throughout the body the way it is supposed to. This could be because the heart is weak or that the muscle is too stiff and will not relax as normal. Some risk factors for heart failure could be heart attack, high blood pressure, heart valve disease, diabetes, coronary artery disease, obesity, smoking, chronic kidney disease, and cardiomyopathy. Being diagnosed with heart failure could be a very scary time, but just know it is not a death sentence and it is a condition that can be managed with the help of your doctor and lifestyle changes. Many patients go on to live a very normal, full life. It is important when treating patients with heart failure to treat the whole person, not only the symptoms. So stress management, getting plenty of exercise, and a proper eating plan is very important. Living with heart failure. It is very important when diagnosed with heart failure to weigh ourselves every morning and record and monitor this weight. We need to report a 2-pound weight gain to our doctor immediately. This is equivalent to an extra liter that our heart has to pump throughout our body. When our heart is already weak, it is hard for the body to pump this extra blood, so it will end up accumulating or building up in places like our feet, our stomach, or our abdomen. So it's very important to call our doctor with that weight gain. We should watch our salt intake. We should have no more than 1,500 milligrams of salt a day. We need to read food labels and know what we're looking for. Salt and sodium are the same thing. We should also watch our symptoms and manage our symptoms every day. Recognize our symptoms early and get our doctor involved. We should look for a cough if we cannot sleep flat, any shortness of breath, or activity intolerance. And with activity intolerance, this means that if yesterday you could go to and from the bathroom without any problem, without having to stop and catch our breath, but when we try to do that today, we are unable to do that. We have to stop and take a minute and catch our breath. That is a sign of activity intolerance, and this should be communicated to our doctor immediately. With exercise, we want our patients to get plenty of exercise, but we also want it paced throughout the day. This means that if you are only able to get up and do 5 minutes of activity at a time without getting very tired, that's okay. Just get up from our chair, walk around our house for 5 minutes at a time, and then go back and sit down and take about a 30-minute to an hour rest period. We also want you pacing your activities or chores throughout your day as well. Do not get up in the morning and expect to get everything done right away. If you need to take a shower or you need to go to the grocery store, try to pace those out. Go to the grocery store, come home, take an hour-long rest period, and then think about getting in that shower at that time. It's important to take our medications as directed by our doctor. Do not take it upon ourselves to stop a medication without getting our doctor involved first. Do not run out of medications or forget to get a refill from the pharmacy. And again, that stress management is very important. Stress and heart failure are linked. So we need to find ways that we can manage our stress through finding an enjoyable hobby like reading or sewing, gardening. Deep breathing exercises and meditation are also a good way to just relieve that stress and give us some quiet time. And if we need to talk to a professional and get them involved, then do that as well. A whole food, plant predominant eating plan consists of fruits, vegetables, whole grains, and legumes with very limited amount of fat-free dairy and lean meats. This is a diet plan that is encouraged because it helps reduce inflammation and helps with weight management. This helps combat obesity and affects the inflammation and stress in our body, which are two leading problems related to heart failure. Also, if we're a smoker, we need to quit smoking immediately. This only increases that inflammation and stress on our body. Knowing when to call our doctor is very important. We talked about this earlier briefly. We need to get our doctor involved immediately when we have any signs of chest pain, shortness of breath, activity intolerance, any weight gain over 2 pounds, or if we notice any of our clothing becoming too tight, our pants, our shoes, our jewelry, or watches. Those are all signs of weight gain or bloating, and we're hanging on to that extra fluid. So get that doctor involved immediately and get him on board so he or she knows exactly what's going on. In conclusion, here at the Lifestyle Medicine Center, we are here to help you with all of your health needs. We have some great resources and programs that we offer to a wide range of patients. If you or your family have any questions or concerns about heart failure or your overall health, please do not hesitate to call us here at 221 Life. Thank you.